we as a community have had trust issues with with people in medicine, and so anytime someone is wanting to change something, sometimes we lose that trust. Well, I know I was taking this brand name, and this brand was working for me, so why do I need to go to a generic? Or somehow we feel like we're less than because they want us to take the generic instead of the brand name. So if you're paying a whole lot more money for it, then it got to be better. Well, no, it's not better. It's they're equivalent, and you're just spending more money than necessary.
Okay. So just to be clear, it is regulated, and as far as the strength of the medication and the effects of the medication, benefits, all of that, the medication, like you say, Tylenol, the active ingredients is, say the word again?
Acetaminophen. Yep.
It is what it is.
It is acetaminophen.
And
Acetaminophen is Tylenol.
across the board.
Correct.
And so that's the active ingredients. It is what it is. It's going to work. And so if if they say, okay, well, I'm just going to take Tylenol, so they're going to pay $10 for the bottle compared to the generic where it only costs $4. But as far as the government and everybody else is concerned, ain't nobody trying to cheat them out of their money. Ain't nobody trying to beat them out of nothing. No. Ain't nobody, it's still the same medication.
Correct.
Okay.
Correct. It's just that.
All right.
It's just that you just get the drug companies get the benefit.
All right, sir.
Of being able to sell the medication that they created for a certain amount of time without any competition.
There you go.
So that's the brand name.
Okay.
And that's why they have that lock on that medication for a certain amount of years. They can charge higher prices for it.
That's it.
But after that time has passed, anyone else, any other drug making company can make that medication and the prices drop. But it's called now generic rather than brand name medication. But it's the same ingredient. So it works the same at the same dose, the same strength.
And that goes the same for even diabetic medication now as far as Ozempic. The active ingredients is say the word.
Semaglutide.
Right, yeah. Which is the same deal. Correct. And so if it comes out and that's the name of it, it's the same deal. Right. Even though it's not called Ozempic, it's still the same active ingredients.
Well, that's the other part.
And
we
yes,
sometimes chuckle about this because semaglutide, Ozempic, all right, you're using that for diabetes. Semaglutide, the same ingredient, you increase the dose, and now you're using it for weight loss, and it's called, I think, Wegovy.
Wegovy, right.
So if you don't understand that you're still having the same active ingredient, if and as physicians, many times we do this for the patients, if you're gonna get Wegovy, it's gonna be $1,300. Mm-hmm. If you get Ozempic, it's gonna be $500. But if we can get you some semaglutide from a compounding company that actually puts the same ingredients, then you get it for $100. It's still the same thing, doing for the same purpose.
That's it.
But it's just a matter of what name they put on it, and then based on that name, they charge you more. So your shirt, this polo shirt doesn't have any names on it, so I got it for maybe $5. But if it said polo, or it had a horse on it, or
there you go.
Then all of a sudden I'm paying $100 for it.
There you go. There you go.
Why?
There
it's
you go.
Providing the same purpose. I think I still look the same, but some people, they get caught up in that, the name brand.
That's right. That's right. That's right.
We still could say ABCs are the big things that you need to be paying attention to, and the A is for A1C level. The A1C level is a percentage that gives you an idea of how much blood sugar has been sticking to your hemoglobin in your blood. That gives us an idea of how high our blood sugars have been running over the last 3 months. So if you have diabetes, or if anyone in your family has diabetes, you should track your A1C level. You want your A1C level to be under 5.7 or lower. However, if you have diabetes, most of our patients, we try to get them down to under 7, and if we can't get them under 7, if you're older, I should just simply say this. If you're much older, we know that there might be a chance of you becoming hypoglycemic where your blood sugar drops too low. So we just tell you can have an A1C level of around just below 8. But for younger folks, it's best to get it down to less than 6.5, and if you can get it to 6 or lower, that's even better. So A1C, that's the A. The B is your blood pressure. So normal blood pressure, we say, needs to be, that top number needs to be less than 140. The bottom number needs to be less than 90. If you can get that top number below 130, we think you're doing even better. And if you can get that bottom number below 85, we think you're doing significantly better. Okay? And then the C is cholesterol. And cholesterol is just a way of getting to know what the lipids in your system, the amount of fatty products that's floating around in your blood that can cause blockage. And reducing that cholesterol level is important. We want your cholesterol level to be less than 200. And based on your health profile, for example, if you have heart problems, we may want that to come down even further. So ABC, A1C, your blood pressure, and your cholesterol level are the things you need to make sure your doc talks to you about. And make sure that you're managing those as well as you can. Anything else? So those are the ABCs. I know someone tried to put a D on there, like your vitamin D level, talking about vitamins, because many times we don't get in the sun and get enough vitamin D exposure. And as African Americans, many times as a result, our vitamin D levels might be lower. When COVID was going around, there were some people trying to blame low vitamin D level for why African Americans were dying from COVID. It's like, that's BS. It's not, wasn't true. But vitamin D is important for all of us. So if you don't know what your vitamin D level is, make sure you find that out too, because you may need to just get it back up to normal. Question? Yeah, if you just get about 2,000 units a day, you should be fine. Most people, yeah. Multivitamin usually has sufficient vitamin D for most people. Yeah. No, unless you have a specific deficiency, a multivitamin is sufficient for everyone. And truthfully speaking, because multivitamins are over the counter, there's hardly any company that's going to do what we call research to prove whether or not you taking the vitamins really make a difference for you. There's one company that did do a study. I shouldn't say it's a company. It was a university in Utah that decided to compare vitamins to see which ones really did make a difference in the health of the people that were taking them. And the only one that they showed that made a difference was, I think, Centrum Silver. So if you're taking your Centrum Silver, you're most likely getting all the right vitamins to help your body process things appropriately. Yes, sir. Correct. If you're taking a multivitamin, you don't need to go get extra C, extra A vitamin, extra anything else. Unless your doctor tells you, because you specifically have an issue with that vitamin.
unless your doctor, your primary
Your
doctor
primary care physician.
prescribes you a specific,
Correct.
yes,
Correct. You
yes.
still take the
There
multivitamin.
you go. Any other questions for Dr. Duggins? See, I'm one of those ones that my doctor prescribed me specifically some specific.
Extra vitamins.
Yes,
Yeah.
yes.
So yeah, you be an advocate for yourself when you go to a physician. If you don't understand what they're talking about, ask them to dumb it down for you so you can understand it. If you don't believe what they're telling you is accurate, go make an appointment with another physician and get a second opinion, so that way you can see if it's valid or not. Yeah, it might cost you an extra $1 because you went to see another doctor just to get a second opinion, but at least many times for my patients, when they doubt me, that's what I encourage them to do, because I want them to trust what I'm saying. And if I'm telling them one thing and they go to another doctor and doctor's telling them something totally different, go, let me know, because maybe I missed something. But most of the time what happens is they just come back and say, well,
You're
okay.
right, you're right.
Yeah, so there's the vitamins that we tell you to be careful about would be vitamin A, vitamin D, and vitamin E, and vitamin K. Those are the 4 that we tell you to be careful about taking too much of them, because they can build up in your system and interfere with other things. So A, D, E, and K. And we used to think that if you took like extra E that you might actually live longer and do better, and then a study over in Europe demonstrated that people were dying sooner when they took too much vitamin E, so no.
How many of you have a primary doctor? All right, all right.
Yeah, don't be bashful about the questions, because
That's right.
you're probably asking the question that someone else was too bashful to ask about.
That's right. And challenge them.
Yeah.
Because just like what Dr. Duggan said, if you have questions about your health, about what they're prescribing, challenge and go get a second opinion and come back, because like Dr. Duggan said, a good doctor wants to be sure that he is doing the best for you. So again, ask questions and be sure. Amen.
Yeah.
Amen.
Don't be afraid. We're not
Don't be
we're
shy.
not high and mighty or so smart that we can't answer your questions. We should be able to answer your questions and explain why we're doing what we're doing for you.
Amen. Amen. Can we say thank God for Dr. Duggins? Amen. I believe he's going to stay around for a little while, just in case. Okay. Okay. Right now we're going to have a drawing bit just before our break. Some of you, I think, all of you all have got your tickets, because they got some drawings, some giveaways they want to give away. Everybody has a ticket. They didn't give me a ticket. You didn't get a ticket, dear? Okay, we need some more tickets. No, you need to get a ticket, dear. They didn't give me a ticket. Priscilla didn't get a ticket. Okay.
Grab some tickets real quick.
She finna get some tickets. Calm down. Just calm down, Earl. I know you want to win. Calm down, man.
We're going to do 2 drawings.
He got 5 tickets in his hand. He ready to win something.
All right, so we're going to do 2 drawings. Right.
Okay.
And we're going to
Okay, we're going to encourage y'all to go to the vendors. When you go to the vendors, you get a ticket to go visit our vendors during the break. Don't start a mob, please. I'm going to have a healing service in here.
Okay.
Dr. DeHart, you're going to have to pray for folks in here, okay? Because they already starting to get rowdy.
Okay.
But that's all right. Yeah, we got some veterans in here that need help. Yes. Okay, all right. I'm sorry. Go ahead on. Call the number, dude.
All right, so our first number is 297449. 297449.
Y'all looking that hard, y'all ain't got it.
297449.
Ain't nobody got it.
That's okay, we'll do another
Who
one.
got it? You got it?
So I'm going to call another one. 297384. 297384.
Okay.
Nice.
Boy,
So
I was about to get word here. Good
So
grace.
we
We
will
ain't
let
got
you
but a
come
few
up,
people.
and you can choose any of these items we have over here.
All righty then.
And then while you're doing that, I'm going to go ahead and call another number.
Yes, please.
We have 297201. 297201. 297201.
All righty. Another AK. Wait a minute.
Do one more. Okay, this one was not here, so I'm putting it back in, if that sounds good. Okay, we're going to do one more.
Okay.
One more, and then we will move on. 297463. 297463. All right, let's try another one. 297265. 297265. We're going to try one more. 297127. 297127. Yes. Should we put these back in or just the analysis?
All right, it's time to take a break. We take a break for 3 minutes, and then we'll be back here so we can get ready for Dr. Gaston. We're going to take a quick break. And we need to check that ticket box. Yes, please go out and visit Common Ground. They got some produce out there. Please go out and visit Common Ground. Go out and visit Common Ground, please. Amen. Visit our vendors and visit Common Ground. How you doing? Yes, ma'am. I sure do. Again, I'm over the God Squad, our legal pastor, and we're trying to get a Hispanic pastor to join us as well. Yes, but if you have any issues at all, yes, we'll come by. And what we do, if there's a police shooting or anything go in between.
Yeah, I understand.
Yeah, and we will go and watch videos with the families or whatever, and we just make sure that everything is done right on the community side and the police side, and make sure everything is done right.
Okay.
I'll be
Thank
right
you so much.
back.
My name is Catalina.
Catalina, God bless you, Catalina. Yes. Catalina, are you interested in being a part of the PCOP? I need more board members. And I need somebody from the Hispanic community to help me like plan these events and other things that we're doing. I need somebody from the Hispanic community so we can get connected with the Hispanic community. Either you or if you know somebody to help me get connected with the Hispanic community.
Yeah, we are, Salomon Bienestar, and we are at Evergreen Library.
Right.
And we did advocate on our community, and we gathered a lot of people because they see a resources for.
Would you mind being a part of our board, or do you know somebody that think about it?
Really think about it,
Pray about
because
it.
we have so much.
I know. But if you know somebody else that would like to be or can be part of our board to help us to plan stuff, I'm gonna build a building here, and we're doing these health fairs. We give out food here, just like over in Evergreen, they give out the mobile sanctuary and stuff,
We are the ones with the volunteers that collaborate with the ancestors with that.
and all of
And
that.
we do that every
Yeah.
first Friday of
And all of that, yeah.
Yeah, we're mobilizers, and we have community coworkers.
Okay.
Let me check and see if maybe a community coworker would like to
I
join.
need a board member.
or-
I need a board member. Okay.
Is a 3-year commitment?
That'd be good. Yes, ma'am. Yes.
No, is
3
that?
years. Yes, yes, yes. Mhm.
Okay, okay.
All right.
Thank you, sir.
Thank you, dear.
especially on those vitamins, because I do take multis, and I take the symptoms, but then I take additions
All right, everyone, we're getting ready to get started again. You got cheese? No, we're finna get started again. Y'all need,
You didn't say nothing about all them vendors over there, and they got all that food and stuff over there, and cookies and
all kind of stuff.
Yeah,
And out there, they
watermelon
got
and
okra and all kinds, they got watermelon over there.
fresh one. I just ate a piece. Watermelon and
Well, they ain't tell me that, you ain't tell me you had watermelon and all that stuff.
they got watermelon and yogurt.
And I'm over here starving to death.
Well, you better go down there.
Let me check my,
Get some spinach or something right off.
I'm about to pass out over in here. All righty, we're gonna get started. We have a conflict. They over there with some food, a food demonstration. And we got our next presenter here, Dr. Reagan DeHart. Dr. DeHart is going to come to us and she's going to speak to us. She's coming from the Robert J. Dole VA Center. She's a primary physician as well. But she, you know, I've known Reagan for a long time, way before she became a doctor. She comes from a good bloodline from Dr. Arthur Dehart and her mother Pat, who is a nurse as well. And I think very highly of Reagan. And what I appreciate the most is when I asked her, she did not hesitate. She said, Pastor, whatever you need, I'm there and I'm ready. And so she's going to also come and talk to us about the importance of having a primary doctor. And what I wanted her to talk to also and address, is that G? How you doing, sir? For him and for Earl and others, she is part of the VA, and I'm a veteran as well. The importance, and we have another veteran in the room as well. I wanted the VA to be represented and to talk the importance about for veterans to know the importance also of having a primary doctor. So, Dr. Dehart, if you would, please come and take the mic. I don't know what Dr. Duggan did with the mic. Dr. Duggan, you kept my mic. What you do with the mic? Oh, it's got to be up there somewhere. On the table? There you go. Okay. She got it. She got it. Yeah.
Good morning.
Good morning. Good morning. I'm gonna round them up as you talk, Doc.
My talk was going to overlap a little bit with what Dr. Duggan's was, but as I was sitting there listening to him, I thought to myself, you know, people really don't know how to navigate the medical system. And we as insiders are the best people to kind of tell you the ins and outs and what you should be doing when you're not getting answers from your doctors, you're not getting calls back, you're not getting the communication. I had, wrote a little bit about just the importance of, forming a doctor-patient relationship with your primary care doctor. Absolutely developing a relationship. I tell people that, this job is as much important for me as it is for you. And you have to hold your doctor accountable. If you are not getting the answers that you need, insurance is very expensive. In a busy primary care office where a doctor is seeing sometimes 30 and 40 patients a day, that's kind of ridiculous. I feel blessed because I've been able to experience primary care from a private practice where it's money driven and you got to get them in and get them out. I then worked for an underserved clinic with Grace Med where you're trying to do the most for people with the least. And now I work at the VA where we have everything at our fingertips for a patient. There's nothing that I cannot do for a veteran. And so I am blessed where a busy day for me is seeing 13 patients. So I get sometimes an hour to sit with a veteran. And I have a social worker, I have a dietitian, I have a pharmacologist, I have an RN, I have an LPN, all on my team. And I can just reach out to somebody if I need to. And so just from that perspective, it's good for people to know when you're sitting in front of your doctor and you don't know what they're saying, you stop them. You say, wait, I don't understand that. Or I don't understand that word. Or I don't know what this medicine is. You as a patient should know all of your medications, what they're called, and why you take them. You should ask your doctor at the end or in the middle of your appointment to print you out your medication list, and either you write it or have them write it next to that medication, why I take this, and when should I take this. When it comes to lab work, most offices have in-house laboratory where we can get that turned back, that comes right back within hours. Now, granted, doctors are busy through the day and they don't get a chance to sometimes look at those labs until quote unquote lunch or at the end of the day or tomorrow or in a couple of days. But if you have not heard within a couple of days what your lab results are, you should be calling that office and say, I had lab drawn, is it okay? Or what were my numbers? These tests that we did, what was that? I've had experiences where things have fallen through the cracks for people for years. Things like CT scans, and by the time that patient has moved on to me, there was a tumor that has been missed, or a mass of some type. So if you're getting x-rays, like labs and x-rays, and you haven't had received word back with those results within 48 hours or so, you call. Now, a lot of people are not technology efficient and savvy, but those who are, many of your doctor's office, they can, you have a portal or a website that you can sign into to see those lab results. And if there's numbers on there that you don't understand, you need to, sometimes you can email the office, sometimes you can email the nurse to communicate, what is this? We have to be our own best advocate, because doctors, we're not perfect. We don't know everything, and it's not an excuse, but we see a lot of people every day, and things can fall through the cracks no matter how efficient we think our offices and our systems work. Things do fall through the cracks. So being vigilant about your own health care, especially in this day and age where, like I said, a lot of it is numbers driven. Doctors needing to get people in and out because they have to use that revenue as keeping the lights on in the buildings that they're on and paying the nurses before they even get paid. And not to say that that is the reason why people go into medicine. We go into medicine because we care about people, and those of us that love the Lord know that a lot of it is our mission, our purpose, is to do that. So it's not about being perfect. We would just want to do the best we can for people, but if you're not getting the answers you need to call that doctor's office. I had also wanted to talk about, when we were talking about ER care versus primary care, reasons to go to the ER versus reasons to wait until Monday. Okay, we don't want to go to the ER if we've run out of our blood pressure medication. We don't want to go to the ER for coughs and sneezes, unless there are certain red flags like pain in your chest, difficulty breathing, I'm feeling numbness somewhere in my body, I'm having a headache that I've never had, my vision is blurry, I haven't produced urine this weekend, I'm not passing gas and my belly is getting bloated. Those are things to go to the ER for. And even before getting to the ER, a lot of our hospitals have in place numbers to call where there's going to be a nurse that's going to answer the phone that can help you, what we call triage, where they will know the questions to ask to elicit whether this is an emergency that you need to call 911, call EMS, or come right on in, or if this is something that can wait till Monday to call your doctor with. Our ER care is what drives up the cost of overall health care, and it can also lead to longer wait times in the ER. There are people that go to the ER with a cough, and they wait there for 8 hours with a cough, and then they see someone, and you may not get what you come looking for. You may not get that antibiotic. They may say, oh, you just have a virus, call your doctor. So knowing that there are levels of care before getting to the emergency room is important. Calling your doctor's office after hours will usually have a recording on there on how to, number one, either get in touch to the doctor who is on call for the practice, or they will give you maybe even another number to call to get that further upper level of advice before proceeding to the emergency room. In the age of COVID now, It's kind of sad to say, but it's reality that it fatigued a lot of healthcare providers. A lot of people left the field, and now a lot of people have come into the field who do not necessarily have the aptitude and the caring spirit to take care of people. So pre-COVID, our medical system was already changing and was a lot less compassionate. And now post-COVID, it is even more, it is less compassionate. So when you find yourself a good doctor that you can connect to, and a good nurse you can connect to, whether it's a nurse practitioner who's an extender of care, the PAs who are extender of care, you hold on to them and you keep them accountable, and you form a relationship with them just like you would any other professional friend. Don't be afraid. It was always very cultural, and there are still a lot of patients that are like this, who they just do whatever the doctors say. And I tell people, no, don't just do what I say. We have doctor-patient relationships. These are decisions that we need to be making together. Just because I say you need this medicine, you have the right and the need to say why. How does this medicine work in my body? What is this doing for me? How long do I need to be on this medicine? So, hold people accountable. That's probably one of my biggest things. And did they say there's some veterans here? Thank you for your service. I love my vets. Are you a patient at the VA? Okay, so you're on the women's team, so very good. Dr. Terrell and I trained together in residency, actually. And, the VA is really a model of healthcare. We have patients who will fly in from Arizona to come to the VA here in Wichita because of the care they receive. When we start training there, they tell you it doesn't matter if you are a janitor or you're a doctor. If you see a veteran in the hallway or anyone in the hallway that looks like they need something, you stop what you're doing and you help someone. So it's actually it's helped me become really a better person. Spending time with veterans, people who have, given the ultimate sacrifice or been at risk of it, to do a job, for this country. So it makes you feel a little bit patriotic. One of my colleagues told me before I started working there that you're not going to know what to do with all that respect that they give you, and they really do. And so it teaches you to actually reciprocate that respect to not only your veterans, but it's kind of my persona now, that you learn to respect basically everyone you see. Not that my parents didn't put that in me, but it's now more in, I guess, the front of my mind of being more respectful to, just humans, period. And that's just something that's really lacking right now. I don't want to go off the rails with this talk about society, but it's just kind of the world that we're living in. People not really caring about each other and their fellow man and their neighbor anymore. And, if we can, even as doctors, pass on some of that, it can become infectious, where my patients are going to start treating their neighbors that way as well. But not to ramble, but do y'all, what questions do you guys have? My biggest point is advocating for yourself and not being afraid to ask questions and hold your doctor accountable, just as Dr. Douglas said, and getting second opinions and not settling for leaving a message and not getting called back. We as Black people, we have to do a little extra because not all the time are our needs taken as serious as other people's. Like already, yes, I'm sorry. Yes, Pastor? In a perfect world, we would seek out doctors that look like us. In a perfect world. But we just don't live in that environment where we have a lot of health professionals that look like us. So that's such a loaded and layered, issue. How to make people feel comfortable enough to go to doctors. I've had patients tell me that they were under the care of this doctor for 20 years and he never touched them. So when I come and touch them, it takes people aback because doctors don't really touch people anymore. But that's something I do. Even if you just laying your hand on somebody's shoulder while you're listening to their heart or listening to their lungs, that kind of stuff goes a long way. So it starts when a doctor is being trained, that there has to be training in medical education about compassionate doctoring, about compassionate listening. Because by the time you get to this level, it's too late. So if a person isn't taught to communicate well with patients of different backgrounds, they're going to be standoffish. And we try. We have they'll do sessions and little exercises with medical students and residents about working with people of other backgrounds, but it's really not stressed. And now, looking back now over my training, I wish it would have been stressed more. I'm like this because of my home training. Yeah. And so not everybody has that, and I don't know how to solve that. I don't know how to necessarily bring people in except continuing to spread the message in ways that we do now. Like, everybody needs a doctor. You have to have somebody, whether it's, even now you can reach out online. You can do virtual visits.
Wow, yeah.
If you have the capabilities. You can even do phone visits, but there are a lot of things that still need to be face to face. But those are ways that the industry has opened up ways of access to primary care. It's just not necessarily sitting face to face. But yeah, I don't know. Dr. Douglas, do you have, since you work with residents, that I don't know, but I think it starts with at the training level.
Yeah. See, 'cause, I think here in the last 2 weeks, I've had 2 members that have spent over 4 days in the emergency room, and for not life-threatening conditions, or not even conditions that was really warranted for emergency care, but just simply because they didn't have a primary doctor, or they were feeling sick or ill, and they had no place else to go, so they just went to the emergency room. And I'm like, I'm stressing more across the pulpit or when I get opportunity to talk to my members. Why don't you have a doctor? Well, I don't have insurance. So I guess the next question, to have a primary doctor, do you have to have insurance, or what does it take to get a primary doctor?
And thankfully in this community, we have a lot of resources where calling down to places like the health department is a good place to start, and then they can direct people to community resources. There are places like, there's Grace Med, there's Health Corps. There are a lot of small little agencies that target the uninsured. Free clinics. The safety net clinics, yeah, that's.
Okay. Okay, okay. I'll get your information then. I'll get your information then. Thank you so much. Thank you.
Yes, sir.
Question.
Doing good, Mr. Roth. You're Mr. Roth. Yes. I'm sorry. I moved. Yeah, yeah, I moved houses, right. Uh-huh.
Give me a couple of them so I can pass it on. In my church, we give them to the church. Okay.
And I should back up. So basic lab work, like our blood chemistry test, our blood counts, our urine, diabetes, thyroid tests, things like that. Those get turned around, you know, within 72 hours. Now, specialty tests like what you're getting from your heart doctor, like if you've had like an echocardiogram and stress tests, sometimes that takes a little bit more time for the doctor to read it and look at the results and be able to put that together to tell you what that means for you. So those higher level tests like that sometimes, you know, take a little bit more time, but if it's a week gone by, like I saw, it was Monday when I saw him, here we are on another Monday, no one has reached out to me, then you should, yeah. Any other questions or comments?
Well, Doctor, again, we had some conflict here because I have a group of people over there in the food demonstration, and they over there, I mean, it's smelling good with jalapenos and black beans and all kind of stuff going on over there on that other side. And they are eating over there. You know, when food get cooking, that's people's attention. But I want to thank you for your presentation because it is very important for us to get dialed in to our primary physicians and to ask the questions, the necessary questions about our primary health, and not always go to the emergency room. And one thing that I'm going to do, I mean, what I've heard from both you and Dr. Duggins, is you all need the help from us to talk to the people, to encourage them. Yes, to seek, and it is resources out there. So this excuse that is constantly being used that they don't have insurance is not a legitimate excuse. There's resources out there for them. They're not aware of them, yeah. So we have to educate them. And that really leads into, I believe, Michelle, what is our next presentation? Is it Dr. Gaston? And that's what's going to lead us into our next presentation, because where we are now with our mental health situation, people need to understand that mental health, where we are today in our society, is critical. We have resources out here in our community to help with our mental health, and we have to take our mental health seriously. Because if our mental health is weak, and if it's not strengthened, if it's not nurtured and taken care of, it'll lead to a whole lot of physical disparities, if you will. So it all starts with the mind. Because if the mind is not right, the body will not be right. So I'm going to turn it over. Another person from the Robert J. Dole facility, Dr. Carmen Gadsden, a dear, is it psychologist, is that right?
Yes, sir.
Psychologist. She's going to come, and please pay attention. I'm going to continue to try to gather them out from the food to come in to hear. Amen. Thank you.
So I'm Carmen. I'm a clinical psychologist. I work at the VA. I also oversee the mental health service there. So we have about 155 employees that work up under me to provide mental health services to our veterans. So thank you for your service. Okay, I'm sorry. Is that good or better? Okay. All right. So I'm going to talk about depression. Okay, and looking at the signs and symptoms of depression, and then how do we treat depression. Okay, so depression is a common mental health disorder that generally will affect how we think, how we feel, and how we act. All right, and there are about nearly 3 out of 10 adults at some point during their life that will be impacted by depression. So that's about 30%. So at some point, 30% of adults in the United States will experience some form of depression. And then for children between the ages of 12 and 17, it's about 20%. Okay, so that's a pretty significant amount, right? When we think of percentage-wise in the population in the U.S., in terms of how many people may be affected by depression at some point in their life. So symptoms of depression, sadness, irritability, hopelessness, losing interest in things that you would generally enjoy doing, changes in appetite. So that means that for some people when they feel depressed, they may eat less. They may eat less to the point that they lose weight. And then on the other hand, there are some people when they feel depressed, they eat more, so then they could gain weight. Depression can affect the way that we sleep. So some people sleep less, and then some people sleep more. A lot of times when people feel depressed, they also complain of feeling tired. They might be moving slower than they normally do. They might feel fatigue. Oftentimes what will happen too is that people will start to complain of what we call somatic symptoms, headaches, stomach aches, body aches. So like if you suffer from chronic pain and you start to feel more sad, or you feel less apt to move, so you're more like a couch potato, right? Then a lot of time achiness, not feeling good, is more common to be expressed, but underneath the physical symptoms is really depression. Not feeling like you're worth anything, so feeling worthless or having excessive guilt. Sometimes difficulties with focusing, so you're not concentrating very well on things like you used to, or you're not thinking as clearly, so it's like your mind is moving slower, right? Or there are times that people, when they feel depressed, they have more thoughts about death. They don't necessarily mean they want to commit suicide, but they're thinking more of what it would be like not to live any longer. And of course, the severity of the depression can readily lead to suicidal thoughts and sometimes suicidal behavior. So those are the symptoms of depression. So it's normal to experience moments of sadness because we're human beings, so we have normal emotions. And we're going to, at times, feel sad or have a low mood or feel melancholy. So that part of it is normal. Sometimes people call it having the blues or feeling down in the dumps. So to have or experience sadness is a part of the human condition. But the thing about it is when you recognize that you are experiencing depression is when it becomes more consistent every day or nearly every day. You're experiencing one of those or multiple of those symptoms that I listed, and it can last up to 2 weeks. So it's like nearly every day, you're feeling sad, not doing what you would normally do or enjoy doing, and it's lasting up or more than 2 weeks. Yes, sir.
You know, there is, and something just came across my mind. I remember when there was a phrase that was used, active alcoholic. Can you be a active depression or be in depression and active, meaning you are depressed, but you're still going through your normal motions?
Yes. So what you're describing is what is considered dysthymia or persistent depressive disorder. So it's still affecting your functioning. So you're not functioning generally at a high level if you were not experiencing depression. So depression affects our functioning, how we work, our school performance, how we get along with other people, things that we would normally do around the house, like household chores. So we might be functioning, but we're not highly functioning because of the low mood of depression, if that makes any sense. Yeah. So there are different degrees of depression. You have mild depression, you have moderate depression, you have severe depression, and then you have what is considered persistent. When someone is diagnosed or they complain of, well, you know, I've been feeling like this for a long time, but I'm still married, I still go to church, I still work, but I still just, you know, have these low moments, these low moods. That is what we call persistent depression. So you're functioning, but you're not functioning at a very high level, because there are going to be moments where your functioning declines or decreases to then you're not doing much of what you would normally do, even at the level of functioning when you have a low mood of depression. So in terms of like, is it nature versus nurture? Okay, so there are genetics, right? Any person can be predisposed to depression similar to, as the physicians talked about, hypertension, diabetes, right? High cholesterol. So the differences in what happens to our brain when we feel depressed. So there's a neurochemical in the brain called serotonin. And it means that when we feel depressed, all of us have serotonin in our brain. It means that it goes low. So we have low serotonin when we feel depressed, okay? Dopamine. So how many people like to shop or fish or do things and it just makes you feel good, makes you feel happy, right? And so, or you eat your favorite meal and it makes you smile, right? So that means your dopamine levels are high. But when you're depressed, that means your dopamine levels are low. So it's like, okay, retail therapy. I go and I do something or buy something and it makes me feel better. I believe one of the ladies asked about nutrition, diet, and exercise, right? So if you're moving, if you're doing something, whether you like to sew, whether you like to cook, whether you like to work on cars or whatever, that's going to boost your dopamine levels, and so you're going to feel less depressed in that moment. So we all have these neurotransmitters that impact us when we have a low mood. Depression can run into families. So there's a lot of studies that talks about like whether they're identical twins or fraternal twins. And so it says that if one of the twins have depression, then the likelihood of the other twin at some point in his or her life will also have depression. In most cases of depression, around 50% are genetic. So there is a high level. My mom had depression, my grandmother had depression, or my uncle, or my father, or my grandfather. So 2 to 3 times more, if there's depression that runs in your family, you'll be predisposed to depression. Yes, sir. Yes, so a person can be genetically predisposed to depression. Yes. Right. So even if even if there wasn't depression that run into your family, you can still be vulnerable to experience depression because remember, approximately 30% of adults in the United States at some point can experience depression. So it doesn't have to run in your family. Yes, sir. So you can be impacted by depression environmentally as well. Yes. Yeah. So in terms of personality, so there are certain personality traits of people that tend to be affected by depression. You ever seen a person, they're pretty, what one could consider neurotic. So they're always busy, they're always worrying about different things. They're pretty high strung. Yeah, so sometimes those individuals can be predisposed or more vulnerable to depression because just as much as they're busy and they're staying on top of things, it can make them vulnerable to be more frustrated. They're easy to get upset, sometimes easy to feel sad, oftentimes can be more pessimistic. So they're looking at the worst case scenario of what could happen. And so if a person is generally focused on what the worst case scenario is, right? And they're constantly worrying, so they can be more vulnerable to experiencing depression. The same is true for people who are more introverted. They don't really like to be around a whole lot of people, kind of like to be by themselves. So the more that they're less engaged in social activities like today, coming to church, different things, sewing circles, hanging out with your friends. So people who are considered to be loners, they like to be by themselves. They can be more vulnerable to experiencing depression. Also, people who tend to be more disorganized. You ever go to somebody's house and there's like stuff that's everywhere, but they know exactly where they can find it. But you're looking like, whoa, how in the world do you function that way, right? They can create more stress. Or people who are dramatic, they create drama, right? They can be more predisposed or vulnerable to depression. And then we talk about environment, right? Natural disasters. Noise pollution. So if you're not sleeping well and you're in an environment where it's very difficult for you to fall asleep or stay asleep and you're chronically tired because you're not getting enough sleep, it can increase your vulnerability to depression. Death of a parent or death of a loved one, that can increase your vulnerability to depression. Bullying. Yes, sir. Go ahead. Yes, sir. Go ahead.
So, the lack of sleep.
Mm-hmm.
Say you're only getting 4 hours of sleep a night. Say you go to sleep about 11 o'clock at night and you're up at 3 o'clock in the morning, 4 o'clock, and you're up. Does that necessarily mean, is that a sign of depression, or could that be something else?
It can certainly be something else, but it makes you more vulnerable to experiencing depression. So if you're not getting enough sleep and you're waking up irritable, disorganized, confused, and you're not functioning, to the best of your ability at where you can function, then yes, it can increase your vulnerability to experiencing depression, but it does not mean that is the original cause for the insomnia. Yes, sir. Any other questions about depression? This is interactive, so how is depression treated? Medication. So a lot of times people will go to their doctor. They can go to their primary care doctor, depending upon the report of the symptoms of depression. So your general practitioner may start you on an antidepressant, or the general practitioner may say, I would like for you to go see a specialist, which would be a psychiatrist or a psychiatric mental health nurse practitioner or a physician assistant. Okay, so you have to start with your primary care doctor generally to describe what it is that you're going through, and then allow working with your doctor to determine if starting you out on a medication would be the most beneficial way to then address your issues and concerns related to depression. There are some people, they say, I don't want to take medication. I take so much medication. I'm done. So then we have therapy. So talk therapy is something that a person can participate in either one-on-one with your therapist or in a group. And so the best hallmark form of evidence-based treatment for depression is cognitive behavioral therapy. So what that therapy is, CBT, it really helps a patient look at the way that he or she is thinking that might be also affecting how they're feeling and influencing their behavior. So if you don't want medication, then of course you can talk to a therapist. So it may be a psychologist or a social worker or a master's level person for therapy. Then there's ECT, electroconvulsive therapy. That's a medical treatment that's been around for more than 40 years. So what they do is you go in, they stimulate your brain to basically cause a mild seizure that reorganizes the brain. Remember, we talked about the serotonin levels, the dopamine levels, things of that nature in your brain to help you in terms of feeling less depressed. So that treatment protocol, you go in like twice a week, up to 12 sessions. There are some people that do that, but many people do not. They don't opt to do that because of the invasiveness of it sometimes. It just in trying to wrap your mind around, okay, what's happening in my brain? Am I really having a seizure? Are there going to be any long-term effects related to that? But the people, in terms of the psychiatrist, the nurse, in the environment of a medical center attends to you very well when a person chooses to use that form of treatment. So they might, I don't want to take meds, I don't want to do therapy, I want something that's going to help me that is evidence-based and proven to be effective. And then most recently, I would say probably within the last 15 years, we have a medication protocol called ketamine or S-ketamine. Okay, so S-ketamine is when you take this treatment and you go in like twice a week where you're getting this medication to treat you for depression, and then you go for up to 15 sessions, and then you kind of titrate down, so you then go every other week to continue that. The other one is ketamine, where it's intravenous, so basically they're giving you the medication IV, and it's the same form of protocol. Now this treatment has proven to be effective for treatment resistant, so that means you've tried everything and nothing has worked. And so you're still feeling very depressed. ECT is for treatment resistant. So you try all of these things and then they're still not effective, so then you move to something that is more intense, but dedicated toward helping you to feel less depressed, if that makes any sense. Okay. And then we just have self-help coping skills. So some people, you know, they're pretty motivated and to read. They're pretty motivated to change their lifestyle, to have a support system, whether that's your families, your friends, your church community, to then assist you with working through your depression. There are some people, they can do that, and they're very successful in terms of making sure they're disciplined enough to maintain that level of coping. So, coming out of COVID, even this year, there's been a higher level of depression because there have been a lot of tough times. Finances, right? Food insecurity, a lot of times, people losing jobs, are unable to maintain their jobs, and different things, a lot of violence, a lot of loss. So how do we manage depression during these tough times? So the first thing we have to do is practice acceptance. We have to be honest with ourselves and not in denial when we're actually feeling more sad consistently. We know we're not actively involved with doing things like we used to, and something's not right. I go to my physician, my blood levels are good, right? I'm maintaining my home to the best of my ability. I'm staying somewhat connected, but now I'm more withdrawn. I might not be coming to church as often as I normally would, or participating in things like I normally do. So being in denial will not help you get to a better place of figuring out how to address the problem. So we got to practice acceptance. And then the next thing we have to do is focus on the things that we can control. A lot of times, if we think about it, we get upset about the things we have absolutely no control over. And this is the thing that negatively affects our mood more so than the things that we realistically have some control over doing. So we have to, and when we talk about these tough times, we're in an election cycle, everything is just really crazy, right? A lot of weird things going on, a lot of things we don't agree with, things that are easily to upset us. And when we sit back and we think about it, we are affected, but how much control over what's happening do we actually have? And so we have to recenter and reorganize our way of thinking to then identify, this is what's in my control. This is what I can handle. This is what I cannot handle. Sometimes we have to remove ourselves from watching the news because it might be too upsetting. Or sometimes we have to remove ourselves from people who are negative and too pessimistic. That's affecting us mentally, emotionally, spiritually. And then we wonder why we're not functioning the way that we're doing. It's because the environment is having such a profound effect on our way of thinking and our way of feeling and our way of responding. And then when someone says, "Are you all right?" "No, yes, I'm good." And you know you're not good. So we have to find these safe spaces to be able to talk about what it is that's going on with us, because if we don't talk, guess what's going to happen? The depression just kind of keeps rising, and we keep falling, and we feel like we're drowning because we're not really dealing with the issues and focusing on the things that we can control. Accept how you're feeling. So a lot of times we want to minimize, discount, or dismiss how we're actually feeling. Whatever the emotions are, they're your emotions. It's okay to feel how you feel. No one should judge how they're feeling or be made to feel like they shouldn't feel a certain way. You accept how you feel. And that personal self-acceptance then helps you to articulate and communicate what's really going on. So then we don't run to the emergency room. We call our physician after talking about it with our family or with whomever we trust to say, I'm not feeling right. Something's really going on with me. Or we acknowledge the observations of others that are saying, you know, you just seem a little off. Are you okay? And rather than dismissing it and pretending to be okay, own it. Accept how you feel. Reach out to other people. So when people are feeling depressed, the number one thing they want to do is isolate. They want to go and get away from other people. And I can tell you that is the absolute worst thing that you can do, is to isolate yourself from other people when you're not feeling well. It is extremely important to reach out and talk about it, or figure out a way that you can find someone you can actually talk to about what's going on. We all went through COVID-19, and that was the hallmark thing, isolation, right? We were removed from the people, from the places, from the activities, from the things that we enjoy. And guess what happened? Depression was on an all-time high. Even after COVID-19 restrictions have been lifted, depression is still on an all-time high because people are struggling to make connections with other people the way that they did pre-COVID. The other thing that's important is avoid negative people. That's sometimes the hardest thing to do. But if we really realize social media, if you're on Facebook or Instagram or Twitter or TikTok, and you're getting all this negative feed because you're responding and engaging with people who are aggravating you, frustrating you, getting on your nerve, making you upset, then guess what happens? You get caught up in what we call a negative feedback loop cycle, where now all this negativity is in your mind. And now all you're focused on and talking about is something that is negative, which is what? That's depressing. When you already have your own day-to-day issues and problems and struggles. So when you're engaged with people who are constantly dumping on you. I was talking to someone, and this guy, he was helping his wife clean up. And he was getting the trash together. And he said that the trash bag was already full, but his wife brought a empty gallon of milk and a big tin can of coffee, and she was trying to stuff it in that bag, and he kept saying, it doesn't fit. What I'm trying to say is that everybody have their own bag of issues. Do not allow someone else to try to dump something onto you that doesn't fit. If it's not your issue, it doesn't fit. If it's not your problem, it doesn't fit. The way that we manage depression during these tough times is that we cannot take on the issues and problems of other people that are not our own. And we find ourselves doing that over and over. It could be a child. It could be a grandchild. Let me tell you, it could be a girlfriend. It could be a homeboy. Let me tell you what happened. And you know, oh, here they go. And somebody in the family saying, get off the phone. Just don't answer the phone. Just don't talk to this person. Because you know that person or these individuals are going to dump things onto you that doesn't belong. Okay, and then the last thing is that we have to engage in self-care. We have to do a better job of taking care of us. How Carmen takes care of Carmen is going to be different from you to the next person. But it is extremely important that you engage in self-care. Self-care could be making sure you eat properly, making sure you get proper rest, making sure you read something of value and of meaning to you that's going to help you to focus on the things that are important in life. Self-care could be turning that phone down, getting off the computer, just sitting in silence. Self-care could be prayer or reading the word. But whatever it is, if you're going to be able to manage depression, anxiety, worry, stress during tough times, it is important for you to take care of yourself. For some people, it's mowing the lawn. For other people, it's gardening. Whatever it is that you can do, please, if you don't remember anything else that I shared, take care of you. Thank you so much. Do anyone have any questions? Yes, sir.
Go ahead, Sam.
Yes, television can be depressing. No, that your recognition of awareness of what's going on is not necessarily depression. But what can be is that if you're watching something that's causing your mood to shift and you're not aware. So say, for example, if you're watching something that is triggering, that shifts your mood, maybe it reminds you of a very bad time period, or you're constantly inundated with information or TV segments that are depressing. And you might be happy-go-lucky one moment, and then after you're watching 30 minutes of an episode, then it's like your mood just shifts. But your awareness of it is actually excellent. Yes, sir.
Doctor, and this is on another, well, talking about our children now, if you will. Attention deficit hypertensive.
Yeah. Okay, so attention deficit hyperactivity disorder. What's your
Yes.
question?
The next one is oppositional.
Defiant disorder,
Yes.
ODD.
Yes.
Okay, so what is it, or?
Yes. Well, how do we address it?
Okay. So first of all, ADHD generally is diagnosed when children are school aged. So that means that this child is generally displaying behaviors both at home, at school, and in other settings. What are the behaviors? They are disorganized. They just can't seem to get things in the correct order. Okay. Johnny, tie your shoe. And you teach Johnny how to tie his shoe. And they do it right on spot, but then when it's time, come on, and you're teaching them, make your bed. Sit here, let's write or do alphabets or do basic arithmetic, right? So how they're presenting at home, sit at the table. This person is constantly fidgety, constantly moving, going 100 miles an hour. You're saying, slow down, son, slow down, daughter. But they're still moving extremely fast. So the first thing that is important, it translates to several settings. They can be in Sunday school, and they're constantly moving. They're impulsive. So that means when you say, okay, raise your hand to answer the question, they blurt the question out and then raise their hand, or they don't raise their hand at all, okay? So inattentive, inabilities of, or I would say difficulties with paying attention, difficulties with focusing, difficulties with being able to sit still according to their age. Okay, so generally children are going to be active. They're going to move. But you have to gauge it based on their age group and what is considered to be normal in the setting that they're in. So what is oppositional defiant disorder? It is when a child is more aggressive, They are more prone to be disobedient. They're generally acting out in emotional ways that are harmful sometimes to themselves or other, throwing things, yelling, screaming, hitting back, those types of things. And it can translate not just to be at home, but also at school or vice versa. So the difference is ADHD is something that is crossing over into multiple environments, several different environments. Oppositional defiant disorder, not necessarily so. Child could go to school and behave, but then act up more so at home or vice versa, if that makes any sense. The doctor asks, is it overdiagnosed in our community? The simple answer to that is yes. We are more vulnerable to have children slapped on with a label of a mental health issue that generally is not. That's why it is extremely important to have the child tested across multiple systems. Within the school system, there are school psychologists who are trained to do that form of testing. And I think one of the best things or best advices that was given earlier this morning is get a second opinion. Don't just take, we got to get so-and-so medicine because they say. But I don't see this at home. That's not ADHD. So it's important to know that asking questions, seeking information across multiple systems before you just give in to a diagnosis is really important. In the multitude of counsel, there is safety. And so just not taking someone's word, I think the other physician talked about advocating for yourself. So advocating for your child to be sure. And guess what? When I first started out as a clinical psychologist, I worked with children and their families. A lot of times for a great number of children, medication is not always necessary. It's behavioral intervention. And behavioral intervention that is taught in the therapy session has to translate consistently in the home. And so when you're doing it at home, then guess what? When the child goes to school, the child is doing what he or she is taught, both in therapy, in the home, and now it's in school. So it doesn't always mean that we have to give an instant fix of medication all the time when there are behavioral interventions that are evidence-based that prove to work just as effectively. Now, there are some children that will need the medication, but there are a greater percentage of those children that can function and do extremely well with the behavioral intervention. I have a lot of adults that, when undiagnosed, have done amazing kinds of things with ADHD or ADD. Yeah. Any other questions? I think I'm beyond my time. So yes, it's more attentional at that point. So meaning that the disorganization might be like, say if you had a workshop in the garage and your wife goes out and help you get it organized, and then you come back and then I don't know where I put this tool, or you're easily distracted. And so did you hear what I said? And you're like, yeah, what did I say? You might want to repeat that. So being easily distracted, poor concentration, not able to concentrate on things very well. So it's more attentional than it would be hyperactive, where there's constant movement as people get older. Thank you so much for your time. I appreciate all of you. I'm sorry. Yes, ma'am. So number one, it depends on the child. Generally, they will give, most physicians or pediatric psychiatrists, child psychiatrists will give what they call holidays, where the child will be off of the medication for 2 to 3 months or so. And it might gauge upon how that child functions during that holiday period, that then they will taper them off of the medication. I don't think there's necessarily a right or wrong. It really is unique to that individual and how he or she is functioning. So do they have to take the medication for a lifetime? No. But that is going to be contingent upon the parent working with the physician, the treating provider, to decide based upon how that child is matriculating through school, through sports, through other community activities, and if their functioning is improving, meaning they're able to manage those issues independent of medication. So they might lower the dosage, see how they do for 6 months or so, and then keep titrating them off of it. But it certainly isn't something a parent should do independent from the doctor. So if that is the goal, the treatment goal, is to say, hey, I don't want my child to be on this medication. Let's say if the baby's in 5th grade, is there a way that the baby can titrate off by 6th grade? So then you work the treatment plan with your provider to then see. But then I also would say the behavioral interventions is going to be a key component in assisting to see how well that child is able to function independent of the medication. Yes.
Any other questions? Can we give God a hand clap of praise for
Thank
Dr.
you so
Gaston?
much.
Thank you. Thank you, Doctor. If we can give the mic back here, I think we have another drawing. And then after the drawing, we're going to serve lunch right after that. So if y'all would like to join us downstairs, we got a lunch planned for you all. I hope that everything that was shared today with you all will be taken to heart. We're going to see if we can give away some stuff here today. I don't know if I'm going to win anything. I got a couple of tickets. Come on, call out some numbers.
All right, everyone get your tickets out. And our first number is 297575. 297575.
No one.
No one has that. We'll go with another one. 297478. 297478. We'll just keep going until we get one. 297481. Yay! Come on up and
Mother
pick your prize.
Lipscomb. All right.
And while she's picking her prize out, I'm going to keep calling numbers.
All right.
So 297373. 297373. Yay!
Oh, Regina.
All right, thank you, ma'am. All right, 297574. 297574. No one has that one? That's okay. I'll draw another one. 297519. 297519. Yay! And I'm going to call some more. So yeah, come check the prize out. All right, 297343. 297343. No. How about 297452? 297452. believe that one was 297343. Two nine seven three four three. All right, we'll call a few more numbers after Olga gets done with her presentation.
Hey everyone, my name is Olga Lesnick. I am a hardcore member with American Heart Association here in Sedgwick County, and I will give it just a couple minutes to see if you can see my slides here. That'll make it a little easier. But to give a little introduction, I'm here to talk about our hypertension awareness and prevention program. Hypertension is high blood pressure. It is pretty easily defined, and we'll talk a little bit more about what that means here in a second. Regina, do you have my slides? Okay, well, let me just get started on this. So high blood pressure really is when your blood pressure is consistently over 120/80, and actually about half of US adults have high blood pressure. It is a very common condition. You most often will get prescribed some lifestyle changes as well as medication. And so working together with K-State, we are offering a blood pressure program that is 4 months long, and now that sounds like a very long time. However, I will say that it is a very low commitment. Through this program, you will get free blood pressure monitor, you will get free individual strategy resources, you will meet with a trained hypertension coach who will help you to identify tools that you might need to improve your blood pressure, and you will get different incentives throughout the program. What it requires of you is to come twice a month to about 15 to 20 meeting with your HAP coach. HAP is the abbreviation of our program. During that time you will meet, you will get a blood pressure reading. You will learn how to take your blood pressure accurately because that is something that people don't often know how to do. There are some rules around measuring your blood pressure. And you will also be able to attend voluntary. You do not have to come to those, but there will be offered once a month a nutritional session during which just like some of you who went to cooking demonstration, you will get samples of foods that we make. You will also get some recipes as well as very important nutritional information on how to actually change your diet for better blood pressure. If you're interested, I have some interest forms as well as flyers. I have somebody who can pass around flyers and interest forms if you want to fill one out now. If not, on the way to lunch, I actually have a table that we can help you learn more about this program as well as fill out the information. Do you guys have any questions? So ideally you would have your arm on a flat surface like a table, and that would be when you're sitting down, that is probably around your heart level. What you want is to have that cuff. If you have a cuff around your heart level, if you have a wrist monitor, you want to have your wrist on a heart level. Yeah, that is not actually recommended way to do that. So what we see often when people go to the doctor is that doctors don't have the time that you need to actually accurately measure somebody's blood pressure. And it is often done in a rush, which is why we encourage people to measure blood pressure at home consistently, regularly, whatever that means for you. If you have healthy blood pressure, you may not need to do it every day, but at least every couple weeks just to keep an eye out on it, because blood pressure is impacted by so many factors in our life, from stress, to diet, to physical activity, to our sleep. Even our sleep can heighten our blood pressure, right? So by consistently measuring your blood pressure and keeping an eye out for those numbers, you're able to better prevent heart disease in your future.
As soon as you go into the doctor's office, you know, you walked from the waiting room you've walked from the waiting room, then you come into the, into the patient room, then they want to take your blood pressure. And I'd be like, can you redo it? Okay. It's like, they don't want to redo it. And also, like crossing your legs, that's a no-no too when you're doing your blood pressure, right?
Yes, so you will want to have at least 5 minutes of rest before you take your blood pressure. That is ideal. That will give you the most accurate blood pressure reading at your, most relaxed position. And then you also want to have your feet flat on the ground. You want to have, as I said, your calf or wrist monitor at your heart level. You want to make sure that you don't exercise, drink coffee, smoke, or drink any alcohol at least 30 minutes before you measure your blood pressure. And you also just want to make sure that for example, things like your bladder. If your bladder is full, you will get a higher reading actually. So you might want to use the bathroom. And things like that are not often talked about in doctors' offices, which is why we encourage everybody to join our program, learn more about blood pressure, and take charge of it. Because the reality of it is a lot of the changes that you might want or need to make for your blood pressure can only be done at home or through your lifestyle changes.
Oh, I had asked you you do these clinics around the city, is that correct?
So our programs come to you. So the way it would work is if we were to do a program here, it would be, we would obviously work with you, Pastor DeShazer, but it would be here somewhere in the church. We would take a room, we would host our clinics as well as our nutritional informational sessions here, because what we want to do is to meet you where you're at.
Okay.
It is often the best way to do it for you.
And so how many people would you need to start this?
So our program's capacity is 15 people for the
15?
4-month program. So all we need is 15 people who are interested, or at least about 10 who are interested, who want to participate, and who we do ask that you either have hypertension diagnosis, consistent high blood pressure readings, or medication for your blood pressure.
Okay.
So that way we can actually help you improve those changes. But we're working to include more people into this program. And the last thing I want to note is if you had a significant cardiac event within the last 6 months, we unfortunately can't do the program with you just because you might have different recommendations from your doctor for your blood pressure and just overall lifestyle changes for your heart health. And similarly with lymphedema, we can't take patients with lymphedema just because it does impact your blood pressure as well.
Okay, well, if you get me the requirements, I will get it, and we will see if we can get you 15 people, at least 15 people signed up so we can have a class here at the church for you.
Absolutely, I'll give you all the information needed, and also please feel free to see me at my booth near the CPR station on your way to lunch, and I can answer more questions.
All right. Any other questions for Olga? All right, thank you.
Cool.
Okay, we're going to go ahead and draw for the rest of our items. Let's see, 1, 2, 3, 4, 5, 6 more items.
I'm gonna give away everything if we don't. Numbers don't recall.
All right, 297479.
Thank you.
297479.
Who got it? All right, Mother Win. All right.
Yeah, come on up and pick out.
If don't nobody else win none, the two mothers got something. I'm happy now. All right. All righty then, Mother. All righty then. All right. No, that ain't cheating. If you ain't cheating, you ain't win. No, that's all right. No, we ain't gonna start that. We ain't gonna start that.
All right, so our next one is 297159. 297159.
I bet you Stanley done won 3 times. He got so many tickets he can't find them all.
Okay. Our next one is 297489. 297489.
I want to know all these numbers called. Where all the people that they're supposed to have all these numbers?
How about 297261? 297261. come on down. Regina.
Regina again? She cheating. Yeah, right. Yeah, right.
The
Don't
more
look at
vendors you
them
visit,
call
the
in their
more
hand.
likely you are to win. So, our next one is 297268.
Hold on.
297268.
No, finna get happy for Mother. Look, Mother Lipscomb again. Oh.
We have 1, 2, 3. Oh, we have 3 left.
There you go. Regina said she gonna keep that, or you out of luck, son. Now, Mother, you keep your gift. Y'all gonna call out another number so we give them all that.
297272. 7272. Yep, 297272. All right, 297130. 297130.
Dr. Gasson, you got any tickets? You got a ticket?
297130.
We got a good lunch downstairs for y'all.
How about
You gonna stay for lunch?
297262? 297262. Two 297126. 297126. uh, 297583. 297583.
You gotta go? Okay, dear. All right. All right.
So who hasn't won
Thank
something
you so
yet?
much for coming, dear. Thank you. All right. Thank you so much.
297583.
All right.
Nice. Come on up.
Rico, you want something? You want something? It's rigged.
Yes, I did call 297262.
Mother Lipscomb won again? Oh, Lord, I gotta sit down now.
That's our 3, right? So I think that's all of it, right? The 1, 2,
Mother, you sure enough a good girl. You're a good girl. Amen. Do your dance. Come on now, don't y'all get picky. Just get the gifts. Lord have mercy. Is that it?
We have one thing
One
left.
gift left? Give it to Chris.
You have a dog?
Chris, call out one of your tickets. S- 7975. That's Chris' ticket. He won. Chris, go and get your ticket. Go get your gift. Now it's lunchtime. So everyone, let us all go downstairs to the fellowship hall and share in some good lunch, all right? And we'll have our closing downstairs in the fellowship hall. Let's go downstairs to the fellowship hall. Sister Lister need help carrying out her hall.